Hey y'all, Sean Starker here, Sit to Fit. Now last week I put out a video on what is an anterior pelvic tilt. Kind of explained what is an anterior pelvic tilt, some exercises you could do to correct that. And I got a couple of people that emailed in, how do I know if I have an anterior pelvic tilt? So that's a really good question. Before starting a program, you want to make sure you have the problem, or else I guess you could see where that would be a problem. So I'm going to show you guys a quick test you can do at home. Doesn't require anything but a marker. You can even get a friend, or a mirror would make the job easier, but you don't need that. I'll show you how to do it if it's just you running a solo trip. But before we get into if you have an anterior pelvic tilt, or how you tell if you have an anterior pelvic tilt, we got to get into a little bit of anatomy. Now, in order to tell if you have an anterior pelvic tilt, you're going to need to measure 2 points on the body. And this is where the anatomy comes in. And don't get bogged down in the names. We're just going to call them by their street name, if you will. And what we're looking for here are a couple of points on the body. One is the ASIS. That's the point right here in the front. If you take your hand and you just get the top of your hip bone there, the top of the pelvis, and you slide down until you get that little bony nodule or protrusion, that's the ASIS, right? So that's going to be our first point. And what we'll do, actually, is since we're here, we'll take a marker and we'll just circle the ASIS. Okay? And we're going to need to find the second point, which is the PSIS. It's right on the other side, and it's kind of different for everybody, so it's not like it's right on the opposite side. Mine happens to be a little towards the middle of the back, or in towards the inside. So I'm going to look for the same type of bony nodule, although it's not going to be as clear, right? It might be a little bit hidden. You might have to really dig in there, and there you would find it kind of right there. So I'll draw a little circle on that as best I can. Hopefully that's a circle. I have no idea what shape that is, but it'll do, right? It'll mark the points, and I'm going to take these 2 points, and what I'll do here is I need a straight edge. I forgot to tell you guys to grab a straight edge. So I'll take the first point and the second point, and I'm going to measure. And now, before we go any further, I want to tell you guys that about a 7-degree tilt is normal. So if you have a 7-degree tilt, an anterior pelvic tilt now to the front, anterior, about 7 degrees is normal. So if you're in that 0 to 7 range, that's pretty good, pretty dead on. But if you're not, then that's when you want to look at the exercises that were in that first program, or maybe look at getting on the 6-week anterior pelvic tilt fixed by Sit to Fit. So you can always check that out. I'll put the links in the comments and all that. Check out the website. But the way that you can do this, if you're just riding solo, right? You don't have a friend to come up and measure and put the stick on you, the straight edge. Then what you'll do is you'll measure those 2 points, the ASIS and the PSIS, and you'll take a picture of yourself, right? So you'll take sort of a side selfie, upload that to your computer, or you can do it right on your smartphone. You can actually draw a line on the, like you're John Madden or something, boom! And what you can do is check and see if that's about a 7-degree, or a 0 to 7 degree. Now remember that 7 degrees is normal, so 7, 8, 9, that's going to be right around normal. 5 even. 0 is a little bit abnormal, but we can work with that in other programs. But for the purposes of really telling if you have an anterior pelvic tilt, it's going to be more than 10, 11, 12 degrees. So that's when we would definitely want to look into the program. I happen to have a turnkey program, a 6-week deal. It's going to get you in, get you out, get this anterior pelvic tilt under control. And you guys can find that at thehealthymovement.net. If you like the video, do me a favor. Leave me a thumbs up. I'm huge on thumbs up. I like 2 thumbs up, but you can only leave 1. So that would really help out. Tell your friends, share, whatever you got to do. Come back here. I'm sure that I'll have something for you if you don't have an anterior pelvic tilt. Don't worry, there's a whole lot of postural inefficiencies or issues. You'll find that we're going to cover a whole lot of them here. So appreciate you guys sticking with us. Look forward to seeing you out there. Live healthy. See you guys later.